ancestors' diets were rich in the essential vitamins, minerals, and phytonutrients needed for optimal health. But today, thanks to declining soil quality, a growing toxic burden, and other challenges in the modern world, most of us are not getting enough of these critical nutrients. That's why I created Adapt Naturals. It's a supplement line based on the principles of evolutionary biology and modern research that closes the nutrient gap so you can feel and perform your best. Unlike most supplements, which use cheap synthetic ingredients your body can't absorb, our products are made with clinician grade, bioavailable ingredients that make a real and noticeable difference. We have a full range of products from the most advanced multivitamin and phytonutrient formula on the market to a blend of 8 organic superfood mushrooms, including reishi, chaga, and lion's mane, to a highly absorbable liquid D3K2 dropper. Our newest product is BioAvail Omega Plus, a blend of ultra pure fish oil and the most bioavailable forms of curcumin and black seed oil in a single 2 soft gel serving. Fish oil, curcumin, and black seed oil are renowned for their powerful health benefits, but until now they've only been available in separate products, which means higher cost and a lot of pills. BioAvail Omega Plus gives you a natural and effective way to improve joint and muscle health, boost exercise performance and recovery, elevate mood and mental clarity, and regulate immune function. Head over to adaptnaturals.com, that's ADAPT naturals.com, to learn more and start feeling and performing your best. Hey everyone, Chris Kresser here. Welcome to another episode of Revolution Health Radio. I've had the pleasure of treating many kids and teens in my practice over the past 15 years. And as you might imagine, behavioral and mental health conditions like anxiety, depression, OCD, panic attacks, ADHD, and a whole range of issues were quite common in that population. We know that from statistics, and it was no different in my work with these kids and teens. And I was always struck by the surprise that parents would express when I suggested that the roots of their children's condition might actually be physiological. Things like gut dysbiosis or nutrient deficiency or chronic infections or other inflammatory conditions that were actually driving the psychological, behavioral, and emotional symptoms that their kids were experiencing. And in fact, in many cases, no doctor previously had ever suggested that. It wasn't really even on their radar. They were just purely treating it as a psychological or behavioral disorder, often with medications that were designed to address the symptoms, but were not even touching the fundamental root cause of these disorders. So I'm very excited to welcome Dr. Kenneth Bock as my guest today. He received his MD from the University of Rochester School of Medicine back in 1979. He's a fellow of the American Academy of Family Practice and the American College of Nutrition, and is a certified nutrition specialist as well, and the founder of the Bock Integrative Medicine Clinic in Red Hook, New York. And he's been a pioneer and leader in the field of integrative medicine for a long time, 4 decades. He's the author of several books, and most relevant to the conversation today, he is an expert on the new childhood epidemics of autism, ADHD, asthma, and allergies. And in particular, he has done a lot to bring our attention to the physiological roots of these conditions, like how some of the things that I just mentioned, like nutrient deficiency, gut dysbiosis, tick-borne infections, other types of infections, can be either primary or at least contributing factors to these psychological and behavioral health conditions. And I'm really excited to talk with Dr. Bock about this because, like I said, there's just not enough awareness in the general community about that link, and it's the fastest way to make progress on these conditions in many cases. So hope you enjoy this conversation as much as I did. Let's jump in. Dr. Kenneth Bock, such a pleasure to have you on the show. I've been really looking forward to this.
My pleasure to be with you, Chris.
So, I have been treating kids and adolescents and teens for some time. You for quite a bit longer, I think. You have 4 decades of experience in this field. And one of the things I've always been struck by, when I would treat a child, and they're oftentimes one or both parents is there, and I would suggest the possibility that their ADHD or depression, anxiety might have a physiological or biological root, like disrupted gut microbiome or chronic infection, a tick-borne illness, nutrient deficiency. The response was often, huh? Something to like no one had ever suggested that as a possibility. It was never really even on the radar. And oftentimes they were relieved because there was something that they could possibly address, or some cause or reason that could make sense for what was happening. But I'm just curious, like, when did you become aware of this in your career, and what has your experience been over the past 10 years, let's say, in terms of the awareness of this in the medical field and in the general public?
That's kind of two questions. Let me take the
Hmm.
first one because that goes back more than 10 years.
Sure, of
This
course.
is my 40th year. You make me feel a little bit older there, Chris.
It's great. Experience.
You know
Experience
what?
is valuable.
I actually think it's invaluable because when you've seen thousands and thousands of kids like I have, I tell parents they have an N of one, and when you have N of thousands, it really makes a difference
Yeah.
in how you can treat. So, but it's really interesting. It dates back to the first book I wrote was 1997 called The Road to Immunity. And at that point, I was really researching the immune system and talked a little about these little peptides called transfer factors. Somebody had read it and got in touch with me, and I started to do some research on transfer factors. There's little tiny peptides that are immune modulators. That means they balance the immune system. And I was really looking how it affected at that time Th1, Th2. There really wasn't a lot about Th17 at that time. I think it came after, so it was mostly Th1, Th2. It wasn't always clear cut, but I was doing a lot of research. And in Autism Society, they got a hold of some of my writings, my research, and asked me to speak. And I spoke at this conference, probably like 1,000 parents, and they didn't know me really, so I was at the end of the conference. One of those things that they put you, they're not sure. And because I had this integrative medicine approach, it really hit the parents and the practitioners in the audience. Anyway, to make it short, a lot of the parents started to bring kids to see me in the spectrum. And, I had a lot of success with an integrative medicine approach because I figured out that over time you had to subtype the kids, just like what you said, with all the different kind of potential causative factors. And and that was microbiome and infections and autoimmunity and inflammation. Inflammation was the underlying thing for so many of the kids. And as parents started to travel from all over the country and then eventually all over the world, they bring their other kids and they say, hey, would you mind? I know they're not in the spectrum. Would you mind seeing this so and so and so and so who has anxiety or depression or panic attacks or OCD, mood dysregulation? And I said, sure. And applying the same approach, I was able to find that so many of them were also affected by so many of these underlying medical biological conditions, including inflammation and specifically brain or neuroinflammation. And so eventually, after at least around 10 years of that, at least I said, you know what, I really have to try to put this together because it's not just the spectrum that I had seen so much. And then it was all of a sudden hundreds and thousands of kids, neurotypical kids, some of who were like, quote, normal, and then like deteriorated really rapidly in terms of, an infection driving brain autoimmunity. So that's really what drove me to it.
Mm. And what's it been like over the past 5, 10 years? Are you seeing more acceptance of these ideas amongst your colleagues, or is it still, been a challenge in that regard?
Now, definitely more acceptance. There's no question. I mean, there's more and more research out there. So when we first started, it was interesting. I mean, it's like my whole career has been defined by treating conditions that became so obvious to me, yet many physicians didn't believe existed.
Hmm.
Reactive hypoglycemia that still physicians don't believe exists. Chronic candidiasis or fungal dysbiosis. Now, of course, the microbiome is huge, but when we first started, and I've been doing work with the microbiome my whole career, they didn't believe it. Come on, you're going to be probiotics, and I mean, really, you look at it, Lyme disease. So I spent the beginning part of my career treating all these kids with recurrent ear infections who were getting antibiotics, and we had to find out that they had a milk allergy or they had chronic candida and dysbiosis and things. And now I treat so much tick-borne disease with antibiotics because,
Yeah.
and then now they don't believe there's chronic Lyme and that you don't need.
Right.
So it's really interesting. So for this whole thing of what's usually referred to as PANS and PANDAS, I don't actually like to use those terms as much because of the quote controversy in some
Yeah.
physicians. So I like, as you read the book, infection-triggered autoimmune encephalitis, or in lay terms,
Hmm.
infection-triggered autoimmune brain inflammation, which I think really kind of sizes it up for the most part. And I think lay people have really, parents have ability to understand that. So I do think, to get around to the answer, is that there is more acceptance, no question. But there were for a while, and there still are, but they're less, pockets. Like, I mean, places where, because in the medical school, I'm not going to give a name because I don't want to, I don't want to, sound like I'm degrading the place, but a really well-known medical school in another state, the pediatricians would say, well, our doctors at the medical school don't believe in this, therefore we don't believe in it. It would literally be, we don't believe in it. So how could you not believe in it? A kid is normal. They get an infection. They rapidly become an alien with all these neuropsych symptoms that could be so severe, but we don't believe it exists. But thankfully, that's changed.
Yeah, I'm thankful for that changing because it's hard enough to be a parent with a child who's struggling with those issues, but then if you go into the doctor and report it and you're made to feel like you're imagining it, or it's got that's so brutal for a parent to deal with. And I've had so many parents over the years come to me in tears, basically
Crying.
being they were because nobody believed them. Their experience wasn't valued as a parent, and they were just told that it was some kind of imaginary thing that they and their kid were making up. It was a horrific experience. And I mean, I love what you said about candida and fungal overgrowth, because that was, if you were to mention fungal overgrowth or candida at a medical conference, that was probably like a surefire way of getting yourself laughed out of a room or eye rolls or whatever. And now you look in PubMed and you can find papers correlating fungal dysbiosis with Crohn's disease and inflammatory bowel conditions and all
Biases.
kinds of stuff. It's all there in the literature. And people like yourself and Leo Galland and others have been talking about this for years, but not being taken seriously. And now that we have the published research to support it, it's sort of like a tacit, oh, okay, I guess I guess there was something to this all along.
No, actually, that's not always said, by the way, Chris. Sometimes it's like
Yeah,
we just discovered it. This is like a new
right,
discovery.
exactly. Yeah, like look what we found. Anyways, it's positive development for all of us that this is
Yeah,
now being accepted in even within at least within the scientific community. As you said, it hasn't necessarily percolated down. I've often found, and I'm sure you have, there's a 10, 20, even 30-year gap between what's showing up in the scientific literature and what you might find with your primary care provider or even in medical schools, which ironically can be the last to change because they're just so deeply entrenched in the current paradigm, right?
oh, really. Yeah, I mean, we don't have the time, but there's a whole story about penicillin.
Okay.
We
Yeah.
don't if we
Well,
don't use it at the medical center. How could it work?
right.
That's
Well, I want to dive in now. It was a good segue. You mentioned just calling these conditions what they are. It was an autoimmune inflammatory reaction in the brain, and that let's talk about some of the mechanisms here and the causes. We've mentioned the gut microbiome, dysbiosis, infections, and things like that. But let's talk a little bit about how, for example, disrupted microbiome might lead to inflammation and an autoimmune attack against the brain. Some of the research has come out around gluten and gluten's effects on the brain in certain kids. Whatever direction you want to go is fine, but I think it's helpful for parents to understand some of these mechanisms, at least at a high level.
the gut brain connection is so key. And I have to say, it's been a key for those of us in this field for so long, with anything from arthritis to dermatitis to brain issues. You can treat brain fog and all this confusion with an antifungal, and it goes away. You didn't give them anything, quote, for the brain. So the key is that there are many things that can cause the intestinal lining to become more permeable. And that can range from gluten and casein, these are like dietary peptides, to all kinds of infections, anything from viral to bacterial to fungal to parasitic, toxicants, even some drugs. There are so many things that can do that, and even stress. So, and when the gut becomes more permeable, and it's in lay terms we call it a leaky gut, but in medical terms it's intestinal hyperpermeability. There are these tight junctions, and they're important because if you think of people can only think of what they shovel into their mouth and in their guts on a daily basis, is pretty scary. So the gut has to be able to discern what it can let through, what's friend, what's foe, what it has to react to. And you don't want it reacting to everything because you're going to be in trouble, especially if it's good stuff. So when something affects the gut, makes it more permeable, it loosens these tight junctions, allows these mediators, whether they be metabolized from the microbiome to any kind of inflammatory mediators that are initiated by whatever is happening, whether it be an infection or gluten or what have you. And it gets into the circulation, gets up to the brain, and then, quite frankly, I have slides that show the actual connections between the endothelial cells, which are these cells that, these single cells that are in the tiny capillaries in the brain. That's where all the action is. They have tight junctions the same way. And so those tight junctions get loosened. And then you have a leaky gut, leaky brain. You have a leaky blood-brain barrier. And that allows all these inflammatory mediators, whether they be immune globulins, because they're pretty large, they're large molecules, and these inflammatory immune cells. And then they wreak havoc on the nerve cells and the companion cells in the brain. So that is the connection. And if you don't heal the gut, you don't get people better. That's with this brain inflammation, but that's also with arthritis, and it's also with the gut is so key. So that's why that's really one of our main focuses. And if a kid is constipated and the kid is having all these GI issues, you really have to tend to that first, or they won't get better.
Yeah, I've seen it's almost like show me a kid with a behavioral disorder, I'll show you a kid with a gut disorder. It's maybe not a one-to-one correlation, but it's pretty darn close in most cases. And they may not even come into the clinic complaining of GI issues, or maybe the psychological behavioral symptoms are more prominent. But when you do a history and you start asking questions about how frequently do you have bowel movement? Oh, once every 3 or 4 days. Like it's not something that's even on their radar as being abnormal or something that needs to be addressed, but it's certainly contributing, a contributing factor. And is it any wonder with antibiotics, highly processed and refined foods, all of the dyes and processed foods that, kids are exposed to, all of the other things that threaten the gut microbiome these days. Like we're really now seeing in the last 2 generations the effects of all of these changes.
100%, 100%.
Yeah. So aside from the gut brain axis, what are some of the other and everything that goes along with that? I mean, that is kind of a foundational factor, even with some of these other challenges that we might talk about. But you mentioned chronic infections. What are some of the other things you tend to look for when somebody, a kid or an adolescent or teen comes and presents with these behavioral or psychological conditions?
I don't want to skirt over the chronic infections because they can be acute infections like strep, which is the classic.
Absolutely. Yeah.
Initially, it's an immune response. And I think people need to understand that when your immune system reacts to an infection like strep, it recognizes it and it makes these antibodies. It has T cells that get into the fray, and also these antibodies made by B cells. But there are these what's called epitopes on the strep. These are very, very tiny parts of peptides, extremely small. But one of those epitopes can look exactly like a piece of the basal ganglia in the brain. So when your immune system to make antibodies to strep, it may see this part of the brain called the basal ganglia and react to that thinking it's strep. We call it molecular mimicry. So that's one of the pathophysiology mechanisms of how it happens, in addition to these T cells, inflammatory T cells. So the strep is one. And the last patient I had today was acute recurrent strep infections, 6-year-old from January through this year, 5. And every time he never had a sore throat. All he had was mood dysregulation, hyper, ADHD, vocal tics, and loud noises. And finally somebody recognized and then referred him to me because they recognized that it was the strep that was doing this. So that's strep. But I think the tick-borne is something I want to really emphasize, because that's something that I pick up so much and is missed. This kid had tick bite when he was a year old and didn't have a bullseye, and so never got tested or treated. So obviously I'm checking him for ticks, tick-borne disease. But that's one of the things. And it's not only Lyme disease, Chris, as you know, it's co-infections, it's Bartonella, it's Babesia, and mycoplasma and things. But so many kids, if they get tested for Lyme, they'll get this one Lyme titer from a general lab that's not really very good for Lyme. Stats show that can only be maybe 55% sensitive. So they get a negative test, say you don't have Lyme. It's a lousy test anyway, and they haven't even looked at the co-infections, especially Bartonella when it comes to rage, which is we call Bartonella rage. So I think it's so important. The key is that your doctor, whoever they see, considers the possibility of infections. And that can range from strep to mycoplasma to chlamydia to all the tick-borne infections,
Viral infections.
and virals like Epstein-Barr, CMV, and all those things. But so we do a very thorough infection profile when we see somebody like I did today, and you have to. So okay, because I always say if they have a tick-borne infection, and if we see a lot of people from endemic areas, which means that ticks are known to be there, and these kids are out playing soccer, and they kick a ball, goes into woods, you go get, and almost half the people generally, they don't always get a tick bite and they don't get the rash. So it's just important to have it on the top of your mind. Okay. And some of these infections are ubiquitous. So
Yeah, becoming more common.
totally. I mean, Lyme disease, at one point they were saying it was 30,000 a year. And then a few years ago, the CDC recognized and said, well, it's actually 300,000 a year. And now it's up into the 430, 450 infections per year. It's really common. But the other thing, it's anything that causes inflammation has to be considered. And I want to make sure that people know, I'm not saying that every psych symptom and disorder has a medical biological underpinning. It's not true. There, a kid, a girlfriend breaks up with the boyfriend and vice versa, and one of them is all of us, they're really depressed and hopefully not suicidal, but it can be that bad. I mean, that's a psychological thing. Now, that stress actually causes inflammation, but that is, it's a psych trigger. The point being is that is sometimes a panic disorder is a panic disorder. There's a past trauma, this or that, even though a lot of times those things do cause inflammation. But it's like anything that can contribute to inflammation, like allergies. Like the kid today, turns out we test him for allergies. They got a milk allergy and he eats tons of milk and cheese. Well, that could make a huge difference in this kid's psyche. Sometimes milk can cause depression and psych symptoms, and not just bloating, gas, diarrhea, those kind of things that we think of. And it's nutritional imbalances, because a lot of the nutrients are involved in the neurotransmitters. So we look at B6, zinc, magnesium, methyl B12, methylfolate, and we even look at the MTHFR gene, which is the gene that helps one convert folic acid to the active methylfolate for the brain. So, and it's not always a frank deficiency. Sometimes it's just an imbalance. And so we have to be aware of that. So we test a lot of more metabolic parameters and functional tests rather than just a static level. And vitamin D is a key level, because for the blood-brain barrier, vitamin D is important, as well as for a proper functioning immune system. So all those things, and then hormones. We see a lot of kids that may have thyroid dysfunction and adrenal dysfunction. And along with adrenal dysfunction, you may see reactive hypoglycemia, which is low blood sugar. And you get the right history where a kid who gets hangry, that whole hangry where he doesn't eat frequently, and gets really angry and can even rage, or might get shaky, whatever. And it's discounted. It's just not looked at. And I just don't understand, quite frankly, Chris, why sometimes it's so blatant.
Yeah, I think another big one is sleep deprivation
Yeah,
there, which of course is inflammatory, affects the gut microbiome, affects hormone levels, everything that we've basically been talking about. Kids these days and teens are burning the candle at both ends, especially as you know, when adolescent teen years they set in, they actually start to need more sleep again. There's a
yeah,
period of time from like 8 to 12 where the sleep number of hours of sleep that are required drops a little bit compared to younger years, and then it increases again at the very time when kids are being asked to wake up earlier, go to school early. They're staying up later because their chronotype is shifting. I've seen a lot of teens and stuff who are going to bed at you know 11, 12 at night because that's how their chronotype is kind of shifting, and then they're waking up at 6 or 6:30 in the morning to go to school. I mean, they're literally 2 or 3 hours less, getting 2 or 3 hours less sleep than they need, and that to me is kind of catastrophic in terms of the consequences.
and I agree. I think it's frequent. I really feel like teens are in a pickle because school is starting earlier because they want to allow for the team sports and the extracurricular. I get it,
Yeah,
but then they're up, and it's also they're up with on social media.
on
They're up on
phones and
their phones, and that's going to keep them from going to sleep. So I agree with you. I really think that teens are getting bombarded these days. It is not easy being a teen. Much harder than I think it was in our day. Much harder.
absolutely, yeah, absolutely feel that way as well. And then just not to gloss over this too much either is, yes, there are kids who are gluten intolerant, there are kids who are casein intolerant, but even just kids who don't have those intolerances, if they're eating mostly flour, sugar, industrial seed oil, which is now like 60% of the calories that the average American eats, those foods are the bad bacteria and fungi in our guts just absolutely have a field day with those types of foods, and that in and of itself could drive gut dysbiosis that can cause these kinds of problems. And as you know, over the last 10 years, there's been a lot of research on this inflammatory cytokine model of depression, for example. It was always, the idea in the past was that depression is a imbalance of brain chemicals, serotonin, neurotransmitters, and now a lot of the more recent research suggests that it could actually be a gut-brain axis issue. It could be inflammation in the gut. Fire in the gut, fire in the brain, right? How long have we heard that in integrative medicine?
100%. And that's why anti-inflammatories work. Listen, there's articles, and these don't have to be natural anti-inflammatories like curcumin and resveratrol and things, but they can be even celecoxib, which there are articles on that. And I use that a lot in the kids because unfortunately NSAIDs can also contribute to a leaky gut, so there's always a
Right.
benefit risk. But yet there are sometimes you add that and it's huge. Some of the kids take ibuprofen and it makes a huge difference.
Yeah, it can be interesting too, just even as a therapeutic trial, right? To see like how much of a role is inflammation playing. You take a dose of NSAIDs, and if they have a huge response, then that's a good indicator that inflammation is a primary driver of what's going on. Even if you then want to find other ways of managing the inflammation later, right?
I always tell them, like, because I use also psych meds. I mean, sometimes they're so bad you need them each day. I mean, I'm
Yes.
not as big on SSRIs as I am on mood stabilizers. I happen to like the class much better, but sometimes low dose Abilify or you need it. I mean, if a kid is so aggressive that the family's worried about it, but I always say it's not enough to give a psych med. You always have to be looking for what's underlying it, but it doesn't mean that a psych med is not helpful for a while in certain situations.
Yeah, I appreciate that you brought that in, and also before also said that, we're not trying to be too reductionist here and say every single psychological behavioral issue is 100% biological, physiological. There are still circumstantial factors that affect our mental health and behavioral health. I think what you're saying here is we need to look at the whole picture together and look for the root causes and try to address those root causes. And yes, if you need to use psych meds as a way of giving relief to the kids and the parents and the families, then sure, but don't only do that, right? Like don't let that be the starting place or the stopping place, which is really what it is. in the conventional medical establishment. There's rarely any investigation into what the root causes might be. And my concern there is the psych meds don't solve the problem. They help with the symptoms generally, but they're not actually addressing the cause in most cases, it seems.
Some of them actually are anti-inflammatory, Chris. So there actually is an inflammatory component of some of the psych meds. But the same holds true with psychotherapy. I mean, I like them, all my kids to be going through, psychotherapy because you have to help them cope. You have, CBT. You have to teach them things. But that all this, and I think you saw it. I said all the psychotherapy and all the psych meds in the world are not going to help a kid get well if he's got an underlying tick-borne infection and autoimmune brain inflammation. It's just not going to do it.
That's right. Yeah.
I'm so excited to tell you about a new product we just launched at Adapt Naturals. Fish oil, curcumin, and black seed oil are renowned for their powerful health benefits. But until now, they've only been available in separate products, which means higher cost and a lot of pills. What's more, many fish oils on the market are rancid or contain toxins like heavy metals and PCBs. And curcumin and black seed oil are not well absorbed unless special preparations are used. BioVail Omega Plus combines the purest and freshest fish oil with the most bioavailable forms of curcumin and black seed oil, so you get the incredible benefits of these nutrients in a single 2 soft gel serving. Those benefits include supporting joint and muscle health. You can boost your performance and recovery and feel more youthful and vital. Improving cognitive function and mood. Sharpen your focus and memory and recover that spring in your step. Promoting metabolic and heart health, which helps maintain normal weight, blood sugar, and cholesterol levels. And regulating immune function, which reduces immune hyperactivity and strengthens protection against viruses and other pathogens. This is an incredible product for anyone who needs extra support with inflammation, pain, joint issues, autoimmunity, cognitive function and mood, and metabolic and heart health. Visit adaptnaturals.com, that's ADAPTNATURALS.com, to place your order and experience the incredibly powerful benefits of fish oil, curcumin, and black seed oil in BioAvail Omega Plus. If you've listened to this show for a while, you know that I'm a super active guy. Depending on the time of year, I'm either skiing, mountain biking, hiking, backpacking, surfing, or lifting weights on most days of the week. I also live in a really dry climate at high elevation. For these reasons, I pay a lot of attention to hydration. I've learned the hard way what happens when I get dehydrated, and I know how important hydration is to overall health. But hydration isn't just about drinking water, it's about water plus electrolytes. This is where Element comes in. It's a combination of electrolytes like sodium, potassium, and magnesium in easy to use individual packets that you just add right to your water bottle. And unlike most electrolyte products on the market, Element is free of sugar and artificial junk. I drink Element every day, and it's made a huge difference in how I feel. Even with my training and profession, I don't think I realized how often I was dehydrated before I made Element part of my daily routine. If you'd like to try it, the folks at Element have an exclusive offer for my podcast listeners. You can get a free sample pack with one of each of the 8 flavors Element sells when you purchase any Element product. This is perfect for anyone who wants to try all of the flavors or who wants to introduce a friend to Element. Just go to kresser.co/element, that's LMNT, to place an order and take advantage of this offer.
Likewise, if, as you're kind of hinting at, even if there's a tick-borne illness and infection, you may need to address that and layer on some psychotherapy because some of those issues, once they get started, they can become kind of a loop, or repetitive patterns of behavior that skillful therapy can be helpful in resolving. So I know a lot of parents, and this is not an easy question to answer probably, but I'm going to ask it anyhow. A lot of parents are listening to this and probably relating, and seeing, imagining that this is impacting their kids. And how do they get help? Obviously you're one option. It's challenging, I think, for a lot of parents because if they take this kind of information to their local doctor, chances are pretty low that they're going to be able to get the kind of help that they need, the testing that they need. I think reading your book is a really good start because then they understand the lay of the land. But
I'll just say it's frustrating for me as a clinician, as a fellow who's been treating these kids for so long, just to not be able to help more people because there's a limit to how many people we can see, right?
That's one of the reasons why I wrote the book. Writing a book takes quite a while, and because it reaches people all over. There's actually been published in 6 languages now, so it reaches people all over the world. And yeah, I'm not, obviously people fly to me from all over the world, but obviously I can't see everybody. I'm not the only one who does it. There are people have to go online. There are, PANS and PANDAS organizations, and there are support groups, and the parents refer each other to doctors in different places. And, the problem is, some are better than others and some are more thorough than others. And, hopefully the parents have to do their research and things. But I think more and more physicians are getting educated. I hear more and more pediatricians who are open to it, who may start even giving an antibiotic for a little bit longer than they might for a strep throat. Because a lot of times you have to treat a pandicins for at least 30 days, let's say. So there's a little bit more of an opening. And then if it's beyond them, if it's a real complicated case, they refer it. So I think all we can do is hope to educate, and the parents have to do their research. I mean, and obviously see people. And, it does make a difference if they're experienced. I have to be honest. I see some people that have seen certain people come to see me and they say, we've done everything. And I look and I say, not even, you probably see the same thing, not even
Yeah,
close.
right. Yeah.
Same thing with kids in the spectrum. I mean, not even close. But so, it is frustrating, but I think more and more there are more options for parents. And I do think maybe starting with either the book I wrote or other books like that can give them a lay of the land and give them an understanding of what they may be looking for and what may be going on, because it makes them also realize that they're not crazy and their kids maybe not crazy, but there's actually something going on.
Yeah. I think we've already touched on some of these points, but I want to like summarize it and condense it. What are some of the signs you look for? Like if a kid comes to the clinic with complaining of some of these issues, the psychological or behavioral issues, what are some of the signs, top signs you look for that would indicate there may be, biological or physiological factors? We talked about constipation and gut issues, of course, but what other signs or symptoms are the biggest red flags for you to go looking
I
further?
think the one is the timeline is the frequently the abrupt onset from a kid who is really, I get these kids who are top of the heap. I mean, they're great athletes. They're really, A+ students. They got tons of friends. And, within a very short time, whether it's overnight, which it can be, or within a certain period of time, they become demons. They become different kids. They're crying, they're aggressive, and they don't have an obvious psych trigger like a boyfriend dropped them or they're getting intensely bullied. You always have to think about that. And I always question whether if they're very different in school and home, that's a clue that it may not. I mean, if you're very good in school and you have only issues at home, that may be the behavioral issues of a teenager and what we call teenageitis. So it's really those kind of questions that you have to ask. So the timing of it, what makes it better? Hey, you give a kid they get sick, and then they probably don't correlate that they deteriorate psychologically, but you give them an antibiotic and they get better, and you can't always see that. But if it's a kind of a repeated thing, or if they have bowel problems, or if they have other symptoms, have they had a tick bite? Do they live in an endemic area? Are they out there hiking and camping? Those kind of things for tick-borne things. But even thyroid, are they cold when others aren't? Are they gaining weight and they're not on a psych med that's going to cause them to gain weight? Are they constipated? Do they have dry hair and dry skin? And is it related to eating? Do they get worse? Do they somehow have more emotional dysregulation after they eat, which may be like a food allergy or sensitivity, or when they don't eat, like a low blood sugar, where they get shaky or tremulous and hangry and stuff? So, I mean, I think it's just a matter of, but even before the testing, that's why at the end of every chapter in the book, I put in all these questions that the kind of clues, because, a lot of times the whole thing, as you probably as a clinician, really, I do a physical on everybody, and that certainly can help. But that that doesn't take that long. It's the history that really points you. 95% of the time, what's happening after you've done a really, really good history, and the labs confirm it. So I always say I treat kids. I don't treat the lab. The labs confirm it, and obviously I can't tell them what their zinc level is or their vitamin D level is or which tick-borne they have. Although I have my thoughts, and hopefully after 40 years, I'm right some of the time.
Got some educated guesses there.
You call them educated guys, but that kind of thing. Yeah, so there are a lot of clues.
Let's talk a little bit about labs because this is a common scenario. I'm sure you've seen, over and over. Where a parent comes in and says, "We've had the labs done; they're all normal," and it is typical in my experience with a lot of these kids that basic labs might be normal. So if they have just a very rudimentary, blood workup where they're they're fasting glucose and just maybe like a CMP, comprehensive metabolic panel, and some of the basic tests that a primary care physician might order all come back normal, or at least within the standard reference ranges that that are used. But those are not the labs that you're talking about. I imagine you're talking about probably much the functional integrative medicine labs or more detailed blood work that's looking at inflammatory, cytokines or markers of inflammation, more specific nutrient analysis, et cetera. So can you talk a little bit about the labs that you
Yeah,
find most helpful?
you need a CBC and a chem profile, or because you need to be able to look at liver and kidney. Because certainly, if you're going to use any medicines, you have to make sure those things are okay. And with tick-borne, they can be abnormal. You can have a low white count. You can have platelets affected, liver function affected. So you have to look at that stuff. Then we do an in-depth tick-borne evaluation. I wouldn't say on everybody, but on anybody that I think it may be playing a role, and it's certainly a lot of the kids. And so that's much more comprehensive. It doesn't only look at Lyme, and we send them to labs that really specialize in tick-borne infections, so that really the literature really shows the variability of labs and how the regular labs really, literally for a Lyme titers, 55% of the time it picks it up. It's almost 50-50. So, we use much better labs. So that's those. And then you have to remember from the regular labs, you can get strep titers and you can get mycoplasma and chlamydia and you can get your viral titers. That all can come from regular labs. And then the more integrative labs, well, we'll also do food allergies, which again, and depending, like this kid had, if they have seasonal allergy, you can do inhalants as well. Those again can come from regular labs. But if you do food sensitivities, that's going to have to go to a specialized integrative lab. And you can check zonulin and markers of intestinal permeability or hyperpermeability. And we get stool analysis that are really look at the microbiome and look at absorption. So many of the kids have malabsorption. I mean, it's not the majority, but certainly a number of them have malabsorption. And so you have to see that. So many have dysbiosis. It's just uncanny. And then we do some kind of a nutritional evaluation. So again, not only just static going to like a LabCorp request and just getting a B1 and B6 level, but getting markers where those, you can test enzyme activity, you can test metabolites, and those metabolites, if they're low or high, can reflect the activity or inactivity of a certain nutrient like B12 or B6 or B1 or zinc or magnesium. And we do look at minerals and heavy metals always. You have to be. So many of the kids are magnesium deficient, zinc deficient.
Or lead, mercury, cadmium, and
And
arsenic
toxins,
more
the
common.
toxins,
Yeah. Hmm.
mercury for sure. Lead is a biggie.
Yeah.
I mean,
Yeah.
and it's missed because it's not looked at. I mean, I have to say, I mean, this is what I wrote in 1997. I mean, it goes way back. I said, if you don't look, you won't see. And
Yeah.
if you listen, you won't hear. And how many, and again, I don't want to put down pediatricians anyway, because they're doing their best. They're having to see so many kids in a day. But
Absolutely.
if you say, oh, you eat a healthy diet, American diet, you're fine. They'll never look at, maybe some of them are looking at vitamin D about now, but not a lot. But they're not going to ever look at zinc or magnesium or whatever. And so many kids are zinc deficient, you know.
Yeah.
or relatively have a relative zinc insufficiency. And I think that's a big point that needs to be made. You don't have to be frankly deficient to need certain nutrients to help you. You know, we all heard of that with people taking zinc, vitamin D, and vitamin C as the trio for COVID. You know,
That's right. We're beyond the, we've largely conquered scurvy and rickets and beriberi and pellagra. That's not what we're talking about here. We're talking about the optimal level of nutrients that can help us thrive and, live long, healthy life. And there's been so much research over the past, 2 decades that suggests that that level is so much higher than the low end of the RDA or threshold at which an acute deficiency syndrome would take place, like beriberi or rickets. And unfortunately, a lot of the lab reference ranges are still configured in such a way that they're really designed to detect those acute deficiency syndromes and not chronic nutrient shortage. And on the flip side of that, it's the same with the heavy metals, right? Where, historically our understanding of toxicity was like, what is the level of mercury that will cause an acute mercury poisoning syndrome, that would lead someone to be in the hospital, was not what's the level of mercury that could cause a chronic inflammatory response over a longer period of time. And that's, in reality, that's far more common in the population to have that level of mercury than it is for someone to have mercury poisoning. That's pretty rare.
exactly. No, and it has to be recognized because the point that I think you just were making is also it's individual. So it's like not everybody needs the same level of nutrients like that because of your physiology and your metabolism and your genetics. You may need more vitamin B1 or vitamin B6 or methyl B12.
Or
So
you have an MTHFR polymorphism and you need more active folate than folic acid. And if you have that polymorphism, you probably don't detoxify very well. So what might be a perfectly harmless level of cadmium or arsenic for someone else might actually be harmful for that person because they can't biotransform or detoxify it very well.
So the point you're making, and I think, and I certainly would totally agree, is this is all intertwined, and that's why it's somewhat complicated. It's in kind of more of a net-like fashion. It's not linear, and it is dose dependent. So that's why when people say we've done everything, and oh, we take this multi and it has everything in it. When you look at the doses, and they're so low, and like for some of these kids who may have dysautonomia, or POTS, which where they stand up and they get either dizzy, lightheaded, get rapid heartbeats, and have fatigue and all that stuff. That sometimes a much higher dose of thiamine, vitamin B1, can be helpful in addition to some of the other salt and fluids and everything. But the point being is that it's varied. Some, your B6 is important for metabolizing some of the neurotransmitters, and some people need much higher doses of B6 and the metabolic P5P and zinc than others. And so I think the key is that it's not one size fits all. And I think that's really, if you know that and you don't have one approach to everything, you have a chance of success. If you have your one protocol for everybody, you will hit some. So you will, and there's no question about it, but you'll miss some of the others. And I think I've prided myself for over all these years to be what I call rather eclectic. I'm really, hopefully I've gained knowledge in all these areas over the years, and you do what each kid needs. And sometimes what that kid needs, another doctor might not agree, unfortunately. And I tell the parents that, listen, I think this is what you need. And you'll have to decide. We always weigh the risk benefits, like longer term antibiotics and stuff. You always have to weigh them, and you have to protect people from antibiotics, just like, from psych meds or anything else. There are nutrients we can give, like NAC and certain herbs like milk thistle. You can protect the liver, you can protect the gut with great probiotics and spore-based probiotics and Saccharomyces, all that stuff. So the key is that you just don't throw things at people without being aware of what they can do and how you can protect them and how you can deal with any side effects if you see it. And I think that's the misunderstanding in medicine. They think that certain things, oh no, that's a problem, when you could really, if you test people on antibiotics, if they have tick-borne disease every month, looking at liver, kidney, and blood counts, yeah, if something pops up, you hold it, you stop it. So the key is to be aware, to be very thorough, and to be very comprehensive. That's how I think with these kinds of situations.
I appreciate that a lot, and I think it's crucial, especially as we move forward. I think this more individualized medicine is really the future, and should have been the past too. But we didn't have the wherewithal and the resources to be able to do it. And look, I have a lot of respect for what we've been able to accomplish with conventional medicine. The ability that we're starting to be able to regenerate tissue and cured blindness and pretty incredible technological advances, and then also incredible research. But one of the challenges with the way the research is set up is this double-blind placebo-controlled trial was really designed as a way of determining whether of drug efficacy and effectiveness, and assuming that the fundamental assumption there is that a treatment will work the same way with everybody, right? That's baked into the concept of a randomized controlled trial. And I've had this conversation with Mark Hyman a few times, and that he was, really dealing with it a lot at Cleveland Clinic and trying to figure out how to study functional medicine, because by definition, it's a personalized, individualized treatment. So it doesn't mesh with this the concept of a randomized, double-blind, placebo-controlled trial with a single intervention that everyone is doing. So it strikes me like what you're talking about, what we're talking about, is much harder, much more complex, much more individualized, and much more difficult to study, frankly, in at least the way that we have set things up so far.
I think part of it you have to accept that. One of my best friends is a cardiologist, and we love each other. We're so close, can talk about everything, but we just don't talk about medicine because he just sees it as that. And in cardiology, that's how it is for them. It's the double blind, and now calcium scores. Interestingly enough, now they were always statins and knocking down cholesterol to not to zero, but to less than 70. Blah 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 blah. And we know cholesterol is important for function of cell membranes.
Cognitive health, yeah.
But now it's the calcium scores, which I happen to agree with, and that if you don't have a elevated calcium score, maybe you don't need a statin. So their studies, they will make those changes. I think in our field, we have to be more flexible and more open to research that is not maybe as large and double-blind placebo-controlled, but is enough to let us know that, boy, this makes sense. The mechanism makes sense. You see it's helping certain people. And the fact that it doesn't help everybody, from my perspective, in autism was this thing called secretin, right? It's a neurohormone secretin. Well, there are kids that talk when you give them secretin. Now you could say, oh, it's in the imagination. I saw kids that benefited. I had parents swear to me that they did, but they did double-blind studies, and unfortunately, the outliers were just seen as outliers, and you mesh them all together. And so I think in autism, the field of autism, they're really trying to do targeted studies where you really like gluten-free diet. It came from my medical school, University of Rochester, did this study, and they totally said it didn't work when the study was totally faulty. I mean, it really was. And it hurt so many people because they would say now, oh, you don't need to be gluten-free because the study shows it doesn't work. And it was because they excluded anybody with diarrhea. Well, it doesn't make any sense. I swear that's what they
Let's
did.
just take out the people who are most affected by it.
Yeah. So in any event, you're right about that, and I think we have to kind of build that into our knowledge, and that we have to use the information we have, and we just have to use our clinical judgment. I was trained in Rochester where clinical judgment was key, so I always tell people, I use labs to confirm, but I don't treat labs. I treat the kids.
Yeah, you treat the kids and you treat the individual kids, which is kind of the point you were just making with study. That's another issue with studies. If you come up with a result that's an average result, but that average result doesn't take into account the pretty significant individual variation of results that might all average out to a null finding, like no change. But it doesn't acknowledge that 10 kids had an incredible change, incredible positive change. And for those kids and those parents,
Exactly.
that's life changing, even though the study might have been a null result and null finding. And so that's why it is so important to treat the individual and not, to respect the research, but understand its limitations in terms of guiding clinical practice.
And ask the question, which is not asked, what is it about those 10 kids that had them respond? I mean, it's like, I remember, I know time is running out, but I remember I went to a lecture down towards New York City by a neurologist on the drug Namenda. Now, I had been using Namenda, memantine, for kids in the autism spectrum with pretty decent results in some kids, but it was only 1 in 6, 1 in 7, which to me is not good. I have so much the results. And so this guy gave his lecture, and I told him when I was doing it, and the results, he said, "Are you kidding? 1 in 6 or 1 in 7 in a condition we have nothing for? That's short of amazing." For me, it wasn't, because I'm used to such better results, but that's the point. So if you can help 1 in 6 kids with something that's really got a very low risk, high benefit to risk ratio, and yeah, the others you do a trial doesn't work, okay. But if you could figure out which ones will respond, and I have over the years kind of tightened that up a bit. But the point being is, if you can help kids so much with certain things and maybe not others, there's nothing wrong with that. And that's the thing. As long as you're not hurting them, there is nothing wrong with having some things that may only work in a certain percentage. You know what I'm saying? Yeah.
Absolutely. And like I said, I think that is the direction: more personalized medicine, personalized supplementation based on genetics, genomics, epigenetics, microbiome patterns, even. Like, we know different microbiome patterns can affect the response to medication and supplements for that matter. So I think we're kind of just on the very early stages of that being a thing, and even AI and some of the new tools that are becoming available might help us to be able to make sense of that and then crunch all of the data that we're starting to collect. But Dr. Bock, thank you so much for being here. Can you tell everyone where they can find more info about your book and just follow your work and stay in touch with you? What's the best way to do
To
that?
find the book, they can go to Amazon, and it's Brain Inflamed: Uncovering the Hidden Causes of Mood Disorders, Anxiety, Depression in Adolescents and Teens. And then my website is bockintegrative.com. It's POCK, and the integrative, not with an IVE at the end. And if they need to get information or call my office, it's 845-758-0001. And yeah, basically, there's a lot on the websites. And the book, I really think, when we're talking about Brain Inflamed, I think for parents, the book was written for parents. So it's really, a lot of doctors and practitioners have read it, but the book, I hope you see, was really made to be very understandable, and use it as something you can go to your own physician with. I'm not saying anybody has to see me, of course not. You go to your own physician, you bring the book, you bring the questions, you bring the clues, and hopefully maybe you can start the process.
Yeah, it's a fantastic resource, and you'll see the Amazon reviews are exemplary. You see a lot of parents talking about how the light turned on for them, after reading the book, and feeling again like they'd seen so many different doctors and just so frustrated to not get any validation for what they know is true, and then finally finding some answers, or even potential answers, just
Yeah,
knowing that
yeah,
there could be these things that they could investigate and get to the root of what's going on. That gives parents hope and kids hope. And to me, that's like the biggest gift for this population, because they spent years really feeling hopeless, I think, and just the possibility that they could find a solution to the problem is really an amazing
really.
gift.
So
So
let's end that with realistic hope. So
yeah,
I never want people to have false expectations. And when kids are sick a long time, you do the best you can to bring everything back. You don't know what changes may be ingrained in there and things. But realistic hope to me is so key. And so many of them have been left without any hope at all. And to me, it's really a tragedy. It's really a tragedy, because we go through this whole thing, about placebos and hope and psycho. We know the mind body is so important. And having parents, and even the kids, some of the kids I see are hopeless. They are
yeah,
hopeless.
absolutely.
It breaks my heart. And hopefully listen, this is my 40th year. I'm still working, because I want to, because I love it. And because you change the trajectory of these kids' lives. And as I said in the book, it's not only the kids, it's the families, it's the parents, the siblings, the uncles, aunts, and grandparents, because these kids, when they're really bad, as they can be really, really bad. So
it can wreak havoc on the family. And it's worth pointing out as we conclude here that everything we're talking about applies to adults too. The population that we focused on in the interview and your population is kids, adolescents, and teens. But guess what? Every mechanism that we're talking about here it also affects adults with behavioral and psychological conditions. So
100%. I treat adults as well,
yeah.
so I totally agree with it. Yeah, I mean, no question. All right.
All right. Well, thank you again, Dr. Bock. It was a great conversation. And thanks everyone for listening. Send your questions, chriskresser.com/podcast question.
That's the end of this episode of Revolution Health Radio. If you appreciate the show and want to help me create a healthier and happier world, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to ask a question for me to answer on a future episode, you can do that at chriskresser.com/podcast question. You can also leave a suggestion for someone you'd like me to interview there. If you're on social media, you can follow me at twitter.com/chriskresser or facebook.com/chriskresserlac. I post a lot of articles and research that I do throughout the week there that never makes it to the blog or podcast, so it's a great way to stay abreast of the latest developments. Thanks so much for listening. Talk to you next time.